Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today, we're learning about barrier methods of contraception. So go ahead, subscribe, and let's get started. Barrier methods are basically one of the easiest concepts to understand in contraception. The idea is very straightforward. Instead of using hormones or affecting the body internally, these methods simply act like a physical wall. They stop the sperm from reaching the uterus, so fertilization cannot happen. Think of it like putting a gate in front of an entrance. If the sperm can't enter, pregnancy won't occur. That's why we call them barrier methods. Now, let's go through the types one by one in a simple way. First, the male condom. This is the most commonly known method. It is worn over the penis and collects the sperm during ejaculation, so it never enters the female reproductive tract. It also has the added benefit of protecting against sexually transmitted infections, which is a big advantage. Next is the female condom. This is worn inside the vagina. It lines the vaginal wall and acts as a barrier to stop sperm from entering the uterus. It gives more control to women compared to the male condom. Then we have the diaphragm. This is a soft, dome-shaped device that is inserted into the vagina and placed over the cervix. It blocks the opening of the uterus. Usually it is used along with spermicides to increase effectiveness. Similarly, the cervical cap is a smaller device that fits tightly over the cervix. It works almost the same way as the diaphragm, but is smaller and fits more snugly. Finally, spermicides. These are chemicals that kill or immobilize sperm. They come in different forms like foam, gel, cream, or tablets. On their own, they are less effective, so they are often used along with other barrier methods like condoms or diaphragms. So overall, all these methods work on the same basic principle. They either block sperm physically or destroy it before it can reach the egg. Simple idea, but very effective when used correctly. All right. Now, let's talk about the male condom. So a male condom is basically a thin covering or sheath that is worn over the penis. It is usually made of latex, but there are also non-latex options available for people who may have allergies. The idea is very simple. It acts like a covering that collects the sperm during ejaculation. Now, how does it work? Its action is straightforward. It prevents sperm from entering the vagina. So instead of sperm traveling inside and possibly leading to fertilization, it stays inside the condom. All right. Now, let's talk about the male condom. So a male condom is basically a thin covering or sheath that is worn over the penis. It is usually made of latex, but there are also non-latex options available for people who may have allergies. The idea is very simple. It acts like a covering that collects the sperm during ejaculation. Now, how does it work? Its action is straightforward. It prevents sperm from entering the vagina. So instead of sperm traveling inside and possibly leading to fertilization, it stays inside the condom. Now, coming to advantages, one of the biggest benefits of the male condom is that it not only prevents pregnancy but also protects against sexually transmitted infections, including HIV. That makes it very important from a public health point of view. Also, it is easily available. You don't need a prescription, and it is affordable and convenient. But there are some disadvantages too. Sometimes, the condom can tear or slip, especially if not used properly. And another important point is that it must be used every single time during sexual activity. Missing even once can increase the risk of pregnancy or infection. So overall, the male condom is a simple, accessible, and effective barrier method when used correctly, with the added advantage of protection against infections. Now, let's move on to the female condom. The female condom is a soft pouch that is inserted into the vagina before intercourse. You can think of it as a lining inside the vaginal canal. It has two ends, one closed end that goes inside and sits near the cervix, and one open end that stays outside. Now, how does it work? Its action is quite simple. It lines the vaginal wall and acts as a barrier, so when sperm is released, it cannot enter the uterus. Instead, it stays inside this pouch. So again, just like other barrier methods, it prevents the sperm from reaching the egg. When we talk about effectiveness, it ranges from about 79 to 95%. Just like the male condom, This depends on correct and consistent use. If it's used properly, the effectiveness improves. Now, one important advantage here is that it is a female-controlled method. That means the woman can take responsibility for protection, which is especially useful in situations where the male partner may not use a condom. Also, it provides protection against sexually transmitted infections, which is a major benefit. Coming to disadvantages, it does require proper insertion. Some people may find it a little difficult or unfamiliar at first, so it may need some practice. Another point is that it is less commonly available compared to male condoms, so accessibility can be an issue in some areas. So overall, the female condom is a good alternative barrier method that gives women more control, while also providing protection against both pregnancy and infections. All right, let's discuss about the diaphragm. So, the diaphragm is a small dome-shaped rubber cup that is placed inside the vagina to cover the cervix. It is usually used along with spermicides to improve its action. What it does is very simple. It blocks sperm from entering the uterus, so fertilization cannot happen. Its effectiveness is around 88% when used properly. The advantages are that it is reusable and does not contain hormones. But on the downside, it needs proper fitting by a healthcare provider, and some users may have a risk of urinary infections. So in short, it's a reusable, non-hormonal barrier method that works by covering the cervix. All right, let's go through about cervical cap, another barrier method. So the cervical cap is a small, cup-shaped device that is placed over the cervix. It fits more tightly compared to the diaphragm. Its action is simple. It blocks sperm from entering the uterus, just like other barrier methods. It is quite effective when used correctly, especially in women who have not given birth. The advantages are that it is small, reusable, and non-hormonal. But the disadvantages are that it also needs proper fitting by a healthcare provider, and it may not be suitable for all women. So in short, the cervical cap is a small, tight-fitting barrier that covers the cervix and prevents sperm from entering. Next, let us discuss about spermicides. Spermicides are chemical substances that are inserted into the vagina before intercourse. They come in different forms like foam, gel, cream, and tablets. What they do is simple. They kill or immobilize the sperm, so the sperm cannot reach the egg. Their effectiveness is around 70 to 80% when used alone, so they are not the most reliable on their own. The advantages are that they are easy to use and do not contain hormones. But the disadvantages are important. They are less effective when used alone, may cause irritation in some people, and they do not provide protection against STIs. So in short, spermicides work by killing sperm, but they are better used along with other barrier methods for better protection. All right, this is the overall mechanism, so think of it like a quick summary of everything we studied. Basically, all barrier methods work in one main way. They prevent sperm from entering the cervix or uterus, so they are physically stopping the sperm from reaching the egg. And in addition to that, spermicides add another action. They destroy or immobilize the sperm, so even if sperm is present, it cannot move or survive. So in simple terms, one method blocks the sperm and the other kills or weakens it. Both together help in preventing fertilization. This is just a quick summary of effectiveness. Male condoms are about 85 to 98% effective, and female condoms are around 79 to 95%. The diaphragm is roughly about 88% effective. Now, the most important point to remember here is this. All these methods become more effective only when they are used correctly and every single time. So consistency and proper use really make a big difference. So in short, these methods are fairly effective, but their success mainly depends on how well and how regularly they are used. Next is about the advantages. One major advantage is that these methods, especially condoms, provide protection against sexually transmitted infections. So they are not just preventing pregnancy, but also protecting overall sexual health. Another point is that they are easily available and non-hormonal. That means you don't need a prescription, and they don't affect the body's hormones. Also, there are no systemic side effects. So unlike hormonal methods, they don't cause changes in the body, like weight gain or mood changes. And finally, they can be used on demand. That means you only use them when needed, not every day. So in short, they are safe, simple, easily available, and give protection against both pregnancy and infections. All right, this is the disadvantages part. First, all these methods must be used every single time during intercourse. If you skip even once, the protection is lost. They can also reduce spontaneity a bit, because you have to stop and use the method before intercourse. Another issue is that condoms can sometimes break or slip, especially if not used properly. And finally, some methods like the diaphragm and cervical cap need proper fitting by a healthcare provider, so they are not as simple as just using and going. So in short, the main problems are consistency, proper use, and a little inconvenience during use. All right, this is a very interesting parts, myths and misconceptions, so let's clear them in a simple way. First, many people think condoms always reduce pleasure, but actually when used properly, the effect is minimal. So this is more of a misconception than a fact. Next, some believe condoms are not needed in regular or long-term partners, but that's not true. They still help prevent pregnancy and also protect against infections if there is any risk. Another common myth is that condoms can be reused. This is completely wrong. Condoms are meant for single use only and should be discarded after one use. And finally, some people think spermicides alone are highly effective, but in reality, they are not very reliable on their own. They work much better when combined with other barrier methods like condoms. So in short, many of these are just misunderstandings, and correct knowledge is very important for safe and effective use. All right, this is about who can use these methods. Barrier methods are generally safe for almost all individuals, so most people can use them without any problem. But one important point is about latex allergy. If someone is allergic to latex, they should avoid latex condoms and instead use non-latex options. Also, methods like the diaphragm and cervical cap are not suitable for everyone. For example, people who have frequent urinary tract infections may have more problems using them. And in cases of certain anatomical abnormalities, these methods may not fit properly or work effectively. So in short, barrier methods are safe for most people, but a few conditions need special consideration. So, that's all about barrier methods of contraception. I hope you all understood the concepts clearly, from types to how they work, advantages, and limitations. If you have any doubts, feel free to ask.